Natural disasters like the tsunami, which caused such devastation in Indonesia, are becoming more and more frequent, perhaps due to global warming. Sadly, the level of suffering in many parts of the world has been compounded by man-made disasters like war and conflict. In addition, millions of people throughout the world are living on less than $1 a day due to abject poverty. As a consequence, over 20 million people have become refugees, fleeing these disasters. The various agencies of the UN are coping as best they can, but frequently find themselves under-resourced, hence the need for reaching out to the suffering by others. Seeing this suffering, a group of concerned individuals set up Human Appeal International UK from a rented apartment in Manchester. And today, Human Appeal can truly be described as an international charity working in 25 countries around the world. Human Appeal Manchester was set up in 1991 as a direct response to the tragic drought in East Africa, which killed thousands of people. This was Human Appeal's initiation into the world of relief work and a totally new experience for the new, young but very enthusiastic workforce. Immediately, relief work was mobilized and aid was distributed to the most drought-stricken area of Sudan, Kassala in the east. In 1992, the world witnessed the unfolding of a tragedy of epic proportions in the Balkans. Out of 2 million Bosnians, over 200,000 died in the conflict, and hundreds of thousands were made homeless and/or refugees abroad or became internally displaced. Human Appeal mobilized its limited resources, and brave young men and women took relief into the heart of the devastating war and evacuated helpless and desperate women and children from the war zone to safety in Britain. The same conflict spilled over into nearby Kosovo, where again tens of thousands were killed and even more made homeless or refugees. The generous help of our donors and selfless determination of our volunteers enabled Human Appeal to help relieve the suffering of countless Kosovars. In 1999 and also in 2003, Ethiopia, one of the poorest countries in the world, hit the headlines again, but again for tragic reasons. Drought, famine and war inflicted immeasurable suffering on the people. HAI set up a water and food project benefiting over 100,000 people in the most deprived and afflicted area of Ogaden. The Chechen people's desire for independence has cost them dearly. Over 100,000 people have died and countless displaced, with most of the infrastructure destroyed. HAI dispatched a number of mobile clinics to provide medical care to people in inaccessible areas. In spite of the booming economy, 1/3 of the population of India lives below the poverty line, and 75% live in rural areas that lack sufficient medical care, access to water and education. HAI provided emergency relief when the earthquake struck Gujarat state in 2001. This included running trauma clinics, building houses to rehouse those who had become homeless, and provided microcredit grants to help rebuild lost businesses. The entire water supply of Kavi village was destroyed in this calamity, so Human Appeal replaced it with a huge water tank which provides water for over 20,000 people. Sadly, turmoil, instability and suffering are words synonymous with Afghanistan, especially since 1979. With little or no infrastructure in place, compounded by a severe shortage of medical aid, especially in Kalat in Zabul province, HAI sponsored a 40-bed hospital which is used by over 200 patients daily. Although Human Appeal has been involved in relief work in Iraq since the first Gulf War, our involvement began in earnest after the Second Gulf War in 2003. The almost unprecedented level of suffering and devastation is well known to the world. Human Appeal has sent £20,000 worth of emergency medical supplies as well as water purifiers to the main hospitals in Fallujah, Najaf and Karbala. In addition, we are sponsoring Al-Qarah Hospital in West Baghdad, paying the salaries of doctors, nurses and medical staff. In addition, your generous donations are enabling Human Appeal International to sponsor a number of schools throughout Iraq. 60 years of occupation of Palestine, curfews and daily violence continue to exact a terrible toll on the welfare of innocent civilians. HAI has initiated a number of income-generating programs, like in livestock and agriculture. Our programs include sponsoring of schools and providing equipment to the University of Khan Yunis, benefiting 30,000 students. HAI has been helping to boost the local economy with its olive oil project, and a mobile clinic has been provided to reach remote areas, benefiting 30,000 residents of Nablus. In 2004, HAI launched an iftar program during Ramadan from the grounds of Al-Aqsa Mosque in Jerusalem, which now, alhamdulillah, has become an annual event. Human Appeal has been responding to the crisis in Darfur by providing an emergency field hospital in Guldi village, serving 16,000 people. In addition, 3 government hospitals were refurbished by HAI in Kas, Nayala and Al Junaina at a cost of £45,000. They were essential in bringing back to health malnourished children and those needing medical aid. HAI regards education as key to empowerment, so educational programs for refugees are sponsored wherever needed. In the aftermath of the tsunami, HAI flew into Sri Lanka and, with the cooperation of the Prime Minister, planned a relief operation involving Qurbani distribution and iftar program, as the majority affected were Muslims. Income generation and the building of homes were a priority due to the total destruction of the fishing community. When the world was alerted to the suffering in Niger, HAI immediately dispatched teams which established a field hospital which was able to assist 100 children at a time. HAI established 4 feeding centers in 3 districts which benefited over 30,000 malnourished children. In Bangladesh, HAI is in the process of building an orphan center to cater for the needs of over 250 orphans in District Bola in southern Bangladesh. Immediately after establishing its physical presence in the earthquake region, HAI distributed emergency relief in 11 villages in the districts of Bagh, Muzaffarabad and Poonch, benefiting more than 10,000 people. HAI also established 3 tent villages accommodating 556 families. On the morning of 8th October 2005, an entire generation of children was wiped out when over 20,000 students perished. The educational system was decimated. HAI established the largest primary school in Muzaffarabad, catering for a total of 397 children in 12 classrooms. After surveying the most deprived and most deserving communities, HAI built 692 permanent shelter homes for the earthquake victims. Each shelter costing £450 and can house on average 6 to 8 people.